I think one of the main issues with cardiac diseases is to be able to deliver the therapy to every cell in the heart.
Yeah.
Like we do have the technology now to correct genes. You may have heard about the CRISPR
Mm-hmm.
technology where you
Yep.
cut out the mutation and you replace it with a normal sequence. We can do that, and we increasingly can do that with high accuracy, meaning that we don't expect to see many corrections in places where we don't want them. But the main problem is still to deliver this to every possible cell in the heart. So you have the machines to correct it, but you need the right trucks to bring it to the right place. And that's where we still have to make progress. I think things are evolving, and
Uh-huh.
there is progress being made. But if you compare it, for example, with eye disease, we know that the eye is very localized and it's very easy to access, and it's much easier to correct all the cells in the eye because you have almost direct access. That's much more difficult in the muscle, and specifically also in the heart muscle. I think where we do see a lot of progress is by understanding better the biology underlying these diseases, because once you've identified the gene, you know which protein is missing or not functioning very well, and you can try to find therapies that work on that mechanism rather
Mm-hmm.
than trying to correct the genetic mistake. For example, the new therapies that are there in hypertrophic cardiomyopathy, they really work on the mechanism of the contractile proteins that are not functioning very well, is largely due to our understanding that's based on a genetic understanding of the disease, because you know exactly which molecules in the heart are not functioning well, and then you can try to design drugs that compensate for these malfunctioning proteins.
Mm-hmm.
And then, yeah, some years ago there was a big buzz about stem cell therapy.
Ah,
Also,
yeah,
they were injecting stem cells inside myocardial infarction lesions
yeah.
directly in the heart. And in vitro, this looked really, really promising. But the problem is, of course, that these cells are not always recognized as your own cells. So they are actually by the immune system. They are just disposed of by the immune system.
Ah,
and
wow.
after some time, they're no longer there. So it creates some extracellular matrix, but that's about it. So it really hasn't given the results that people were expecting.
Yeah, and I think another issue is to get the cells to the right maturity that they need to replace other heart cells. So we can culture cardiomyocytes, so heart muscle cells starting from stem cells, but they don't reach the same maturity as they should in the heart.
Because
And that's also an issue where we still have.
stem cells are new cells that you're implementing in
Yeah,
someone.
there's methods now to make stem cells starting from a regular blood cell or a skin biopsy. So that's possible. We can reprogram blood cells or fibroblasts originating from a skin biopsy to become a stem cell, and then you can differentiate that stem cell into the direction of a heart muscle cell or a cardiomyocyte. So that's all possible.
Mm-hmm.
But what we do see is that those cardiomyocytes, so these heart muscle cells that we create, don't have this exact same characteristics as the heart muscle cells, because it's a kind of logic that it takes 9 months to grow a baby and then a whole life
Yeah.
of functioning, that it's hard to mimic that in a dish to create these heart muscle cells. And progress is still made, but the maturity of those cell types is still under investigation, and we need still to make progress before they will be also, or before they can be used as a treatment strategy.
What is actually something that you both find very interesting of developing therapies?
I think that gene therapy, if it works, is of course will be the holy grail.
Yeah.
If we are able to inject the gene that has been corrected inside the cell machinery, so it produces the correct protein. That will be fantastic. I think that's the holy grail. If you can do that, then you can really stop the disease in the patient in front of you. At the moment, if we find a mutation in a patient, we can prevent transmission to their children, to the offspring. So that's what we call primordial prevention. But this requires, of course, IVF techniques. And it is reimbursed in Belgium, so it's possible. And we give the options to patients that have a class 4 or class 5 disease-causing variant. But of course, for the patient already in front of you, having the disease, at the moment, as we already mentioned, we can give medication, do lifestyle modifications. We sometimes use ablation techniques.
Yeah.
But it would be wonderful if we would be able to correct the underlying problem. And at the moment, this is not possible. For some diseases, this is not that worrying. Some of those are not progressive, but some of the diseases are really progressive, where the muscle really deteriorates over time and over the years. So if we can already stop this deterioration and freeze the heart in the state that we find it, that would already be a huge advantage. Yeah.
So I think as a geneticist, I'm looking at the genetics.
Yeah.
I think we can still learn a lot from a principle that we call genetic modifiers. So we always talk about this one gene, one mutation, but of course we have 21,000 genes, and that one gene never behaves by itself. It's always in the context. And there is some interesting observations that we can make both in humans, but for example also in mouse models, where we see that a phenotype, in this case cardiac condition, can completely disappear when you change the genetic background on which this mutation is acting. So that's quite interesting, because it shows us that nature has ways of compensating for the presence of that one mutation.
Oh, wow.
And I think by learning more about that, we can try to mimic them afterwards by medications or other strategies.
Yeah.
So I think nature itself can teach us some lessons.
Yeah.